Republicans say they're ready to hit the ground running on Obamacare. They have vowed to repeal and replace the health care law, but now there is an emerging rift inside the GOP over exactly how to accomplish that. Let's talk about it with Liz Smith, the former deputy campaign manager for Martin O'Malley. Scott Jennings is a former special assistant to President George W. Bush and the former Ohio state director for Mitt Romney's presidential campaign. Thanks, both of you, for being here. Scott, I want to start with you because Republicans have talked about voting to repeal Obamacare without having a replacement ready to go. Is that a wise decision?
Well, this is going to be a multi-step process. They have to get the budget votes going to set up the process to repeal Obamacare. And I think what's important to understand here is that there can be a stable period. It could be a long period so that nobody who currently has health insurance loses it immediately. They're going to have to do a series of complicated things to repeal it and then replace it with a series of policies that Republicans have been pushing for many years. So I think it's a little bit of a false choice to say we have to do it all at one day or not do it at all. I think the process can get started and then they can go through the machinations of installing the policies that will do what Obamacare promised to begin with: increase access and lower prices. It's done neither. It has not afforded universal access, and prices, as we know, have skyrocketed. So those are the things that we have to focus on fixing, and I think the Republican policies will do that eventually.
Liz, we've heard people like Senate Minority Leader Chuck Schumer saying the Republicans have no plan to replace, but I'm not sure how he would know. He has not been inside those Republican meetings to talk about replacement.
Well, look, if the Republicans have a plan, then prove it. Show it to us. But they've had 6 years to come up with a replacement, to coalesce around any sort of replacement, and they haven't. And, you know, I have to sit back and laugh a little bit as a Democrat because for years, Republicans have tried to use this as a political cudgel against Democrats, and now, you know, they're getting a taste of their own medicine. It's one thing to cast, you know, dozens and dozens of protest votes for a repeal that you know that the president won't sign. It's another to take away health care from 20 million people, including people who need it most: kids, seniors, women, people suffering from dealing with substance abuse. And that's what Republicans are facing now. And that's why you see, you know, Republican senators dropping like flies. You know, 7 now have come out against just immediately repealing the law. And I think the most important people to listen to here are governors, because they're the ones who are implementing this law on the ground and seeing its effects firsthand. And governors like John Kasich in Ohio and Rick Snyder in Michigan, both Republicans, are saying that this law has been a success and that Congress needs to tread lightly if they're going to try to repeal this.
But it's also true, Scott, that the increased Medicaid enrollments in the individual states are really proving to be a financial problem for many of those states.
Well, first of all, that's true, and it's ridiculous. No Republican is out there talking about taking health care away from vulnerable populations. And I agree with Liz. We should listen to governors. Listen to governors like Matt Bevin in Kentucky, as you point out, John, who say the state government can not have this huge financial bill that's coming due because of the Medicaid expansion. Remember, Obamacare has largely been an experiment in putting people on a government-run health plan called Medicaid. It did very little to increase private coverage, and the people that were forced into these exchanges are now seeing massive premium hikes because they didn't want to be in it in the first place, but they had to do it, and now they have to pay for it. And so at the end of the day, state governments are vulnerable, working families are vulnerable, and it's all because of the cost. We have to decrease barriers to access. We have to increase competition. We have to reduce prices. If we don't do that, this whole thing is going to collapse. That's why the Republicans have to get started on repeal. This thing is on a death spiral right now, and it is going to cost people if we don't get the repeal process going.
Liz, paraphrasing your earlier point, you said that Democrats are sort of pointing fingers at Republicans and saying, look, it's not that easy, and you're finding it. But it's also true that Democrats passed this thing without a single Republican bill, Republican vote. So why should Republicans, you know, be embracing Democrats in their hopes or in their plans to change this?
Well, first of all, Democrats, as you pointed out, you know, Democrats do, to some extent, own Obamacare, and they know better than anyone else how difficult it was, you know, to build up the Affordable Care Act. But I'm not just saying that they should show it to Democrats. They should show it to the American public, because it's not just Democrats who rely on Obamacare. It's a heck of a lot of Republicans and a heck of a lot of Trump voters. And in Scott's home state of Kentucky, I believe that there are 600,000 people who have gotten health care coverage under Obamacare. And look, let me just address a couple falsehoods here.
Well, very quickly, we're getting back to the hearings.
The cost of health care has grown at the slowest rate in 50 years, and 20 million people have coverage because of this law, and we should not throw out the baby with the bathwater.
All right. As we've been speaking, the New York Times is reporting the President-elect Trump says he would not accept a delay of more than a few weeks for Obamacare replacement. That, again, according to the New York Times. Liz Smith and Scott Jennings, thank you both.
Thank you.